All right, since it is 7 o'clock now, Mountain Time, we are going to go ahead and get the webinar started. Hi, everyone, and good evening. Welcome to the third and final webinar for the BCRC's Winter 2025 webinar series. Today, we will be focused on the ins and outs of parasite management. I am Kristen Thompson, Knowledge Mobilization Specialist with the Beef Cattle Research Council, and I will be your moderator this evening. We are happy to be able to put these webinars on the Knowledge Dissemination and Technology Transfer project funded by the Canadian Beef Cattle Checkoff and Canada's Beef Science Cluster. Before we get started, I'm going to go through a couple of housekeeping rules. You will be able to see and hear myself and our speakers, but we cannot see or hear you. We ask that if you do have any questions, please submit them as they come up through the Q&A tab on the bottom of your screen, and we will answer them in a live Q&A session at the end of the webinar. This webinar is also being recorded, and we will be sending out the recording to all who have registered in about 3 to 5 business days. You can find recordings of all of our past webinars and other great videos on our website, beefresearch.ca, or on our YouTube channel. This webinar is also available for CE credits for veterinarians and registered veterinary technologists across Canada. If you identified yourself as a vet or RVT, when registering for this webinar, you should receive your certificate via email in the next few days. Remember, you have to stay for the entire webinar to be eligible for the CE credit. CE credits are also available for past webinars, which are listed on our website. Credits can be obtained by watching the webinar recording and receiving 80% or higher on the associated quiz. For more information on CE credits, please visit beefresearch.ca/CE credit. This page provides details on how to receive credit for both live and recorded CE events and includes some frequently asked questions. If you have any further questions or have not received your certificate within a week of the live webinar or completion of the quiz, you can contact Dana Parker, whose contact information is up on the screen. On beefresearch.ca, we also have numerous resources on parasites, which includes 2 topic web pages, one on internal parasites and the other focused on external parasites. On these pages, you will find detailed information on common parasites, best management practices. We have a number of infographics to highlight different concepts, as well as previous webinar recordings. There is also an episode of the Canadian Beef Cattle podcast focused on tips for managing parasites in your herd. I will include some links in the chat later to some of these resources. To remain updated on these resources and other new resources, please subscribe to our mailing lists, and I will include a link to that in the chat as well. Now, without further ado, we have 2 very exciting speakers for you this evening who are ready to share their thoughts and answer all of your questions. I'm going to introduce our first speaker, Dr. John Gilleard, and invite him to share his screen. Dr. John Gilleard is a veterinarian, professor of parasitology, and associate dean of research at the University of Calgary Faculty of Veterinary Medicine. His research program focuses on anti-parasitic drug resistance, molecular diagnostics, and improving sustainable parasite control. He has a particular interest in ruminant parasites, but also has active projects in companion animal and human parasites. He is a fellow of the Canadian Academy of Health Sciences, a fellow of the Royal College of Veterinary Surgeons, and a former president of the American Association of Veterinary Parasitology. With that, I will turn it over to you, John.
Great, thank you, Kristen, and thank you to BCRC for the invite to give this webinar. So, as Kristen said, I'm going to kick off and then Carling is going to take over after. I'm going to specifically talk more about the background and principles of sustainable parasite management, a little bit of research, how that layers into it, and some future trends and directions we should be headed. And then Carling's going to come in and talk more about the here and now, the practical approaches over a production year. So, just to orientate ourselves, when we talk about parasites, it's often it's forgotten there are a lot of different groups of parasites, and really we can break them down into 2 big areas, external and internal. And one of the things I want to emphasize throughout this little segment is we really should be thinking of these separately. Now, what I'm going to focus on, and I think Colin too, is predominantly gastrointestinal roundworms. and also lice. But there are obviously lots of other groups of parasites which cause problems in beef cattle. But those are the two kind of topical ones and things that drive a lot of our parasite control thinking. And the reason for that is we have the so-called wonder drugs that have been around since the 1980s, which are this group of what we call endecticides, which mean they have activity against both internal and external parasites. You might know them as mectins or ivermectin as a group of related compounds. But the thing about these drugs is they affect or they have activity against an incredibly wide range of different parasites, both internal and external. And because of that, I think what's happened to the industry and parasite control in general is become very dependent on the routine use of these products and assuming that they work well on all these organisms, which is as you will hear, less the case these days because we're starting to get, or more than starting to, we have significant resistance and a number of parasites against these products. So that's a segue to this next section, which is really making the point that this blanket use that we've relied on so long now in terms of just you particularly pour on macrocyclic lactones or endecticides, it really isn't very sustainable. And increasingly, it's not always that effective. And so the reasons for that are twofold. One, we have dewormer resistance. And all I want to say about that without going into details is when we apply these products, but by killing the susceptible parasites and allowing the few resistant ones to survive, gradually give us selective advantage to the resistant ones, which gradually increase in frequency in the population until we get to a point where the majority of the population is resistant and then the product no longer works. And this is a really slow and insidious process, which is one of the challenges in terms of managing it. Also, increasingly now, we're concerned about the environmental impacts of these products. And we know there are residues in soil and water. We know they have negative impacts on all sorts of invertebrates and even aquatic animals in the environment. And again, I'm not going to talk about that, and there's lots we don't know about it, but it's a factor in terms of the public perception and social license we have and the whole sort of sustainability piece around using these products in a non-targeted way. So one thing to really emphasize is the aim is not to eliminate parasites, because that's kind of impossible anyway. But what we're trying to do is minimize the health and production impacts. And I would argue these days also at the same time as minimizing the dewormer or insecticide use we're using. And this idea of decoupling internal and external parasite control is critical to this. And when we use products such as ivermectin in that group, and we apply them as a pour-on, we're not just applying selection to the organisms on the surface of the animal. Those compounds are absorbed, they have activity to internal parasites, as we know, but they also select for resistance. So if people are using them to treat lice, for example, you're also at the same time selecting for resistance in the internal parasites. So that's an issue, and it's fine as long as we're using the drugs in a way that we need to, in terms of using them on the basis of need. So, one of the things we're trying to promote these days is going away from, what we've done in the past and to a large degree still doing is this treat first approach of we'll just treat anyway because they may well need it, to more an assess first approach where we're actually asking, do we need to treat with these products? And if so, how and which ones and when and those kind of issues. So it's a much more targeted approach we'd like to get to. So I'm going to start with roundworms. Again, I'm not going to go into lots of detail, the background parasitology, but I just want to reorientate people. Some people know some of this stuff, some people maybe less so. But really, when we talk about roundworms, we're talking about a variety of different species of roundworm which live inside the gastrointestinal tract. And they're small worms and they accumulate in large numbers in terms of thousands or tens of thousands. And they breed, they produce eggs which pass out in the feces, and these eggs then hatch and larvae emerge actually inside the fecal part, develop through a series of multitudes of microscopic larvae which go onto the pasture, which are then ingested to complete the life cycle, which develop to adults. There are also these inhibitor stages, which I'm not going to go into because of time, but those complicate things a bit in terms of control. But that's essentially the life cycle. And when you think about grazing cattle, it's really all about the accumulation of these infective stages on the pasture over the grazing season. And so what happens is, as more eggs pass out, develop, reinfect, and you get the cycle going, which from the beginning, and I'll mention this a little bit more, from ingestion of L3s through to eggs in the feces is about 3 weeks, and the development on the pasture is very variable, as I'll explain. There's this accumulation, and over time you get larger numbers and then larger parasite burdens along with that as the grazing season progresses. One thing to point out is that all this transmission I'm talking about occurs actually at pasture. These larvae survive very well on pasture, and that's where all this happens. Once we go to calves entering feedlots, there's no transmission in the feedlot, essentially. So we don't need to worry about the cycle in the feedlot or in housed animals generally, because the environment's not conducive to these free-living stages. But of course, calves coming into the feedlot from pasture may well carry parasites, which is why we often treat on feedlot entry to remove the parasites, to remove any negative impacts on growth. So what I wanted to really emphasize is there's really no blueprint. There's no recipe for roundworm control. We can just say, this is what beef producers should do. We really have to take, which is this bottom point here, more risk assessment approach. And the reasons for that is, there's lots of reasons, but I broke down through the big ones. Dewormer resistance is now present and varies between herds. Subclinical production impacts due to roundworms vary from herd to herd, depending on a whole variety of variables. And also grazing management will vary, which will impact this. And so I'm just going to briefly just touch on each of these to illustrate this variability in point. So let's talk about dewormer resistance. First, it's a question that often comes up. How bad is it? What's the situation? Well, this is a study we did quite a number of years ago now. We published it in 2017. Actually, samples were collected in 2012. So, you know, this is over a decade old, this data. And this really just shows the reduction in fecal egg counts in different herds after ivermectin treatment. So you expect 100% reduction if the ivermectin poron's working perfectly. And this is looking at producer applied poron treatments. And you can see for these herds in Alberta, Saskatchewan, a few in Manitoba and Ontario, you can see it's well below the certainly 95% threshold, which is this red line here. Some of the herds is very little reduction in egg counts, others it's moderate, and the rest of it. And so this tells us, and for quite some time now, that porons are not anywhere near 100% effective at removing roundworms anymore. And this wouldn't have been the case when these products were launched. We have done a study, and there's a lot on this slide, and I'm not going to go through the trial. I only put the trial up in this form to hopefully convince you that we've done detailed studies on this in terms of showing there is resistance. So if I go back, I mean, this is producer applied poron efficacy, if you like, whereas we've done studies, and this was a collaborative study with colleagues at WCVM, looking carefully at a large fecal egg count reduction test, which does really what I described earlier in a very controlled fashion, and really demonstrates that these worms are resistant. So that's all I want to say about this because of the limitations on time. But essentially, in this big study, we had just above 80% reduction in fecal egg counts overall with ivermectin treatment. We showed that there were multiple species which were resistant in terms of the adult worms in the animals. We showed inhibited larvae stages of osteotage, which is the most damaging parasite, is also resistant. Interestingly, in this study, a combination of ivermectin and fenbendazole, so that's safeguard essentially, was still highly effective, and I'll come back to that in a second. So overall, and these calves were sourced from pastures from market in Saskatchewan, so if you like, a mixture of calves from different sources. So this level of resistance in a mixed population shows us it's essentially widespread in the region. So in summary to that, we've got two groups of dewormers, essentially, the macrolactones, which are these endectocides, and we've got multiple species resistant to those. The level of resistance will vary significantly between herds. And then when we look at the other big group of dewormers got available, the benzimidazoles, such as valbazan and Safeguard, we still think, although I have to say the study we did, which I'm not going to show on this group, was back in probably, I think it was about 2018, we didn't find much resistance at all at the moment in Canada, but we've done studies with colleagues in the US, and it is emerging in the US. So you've got two groups of dewormers, one for which there's multiple resistant species to a varied extent, and the other where there's, as yet in Canada, we don't think much resistance. But obviously, the more we use these products in a non-targeted way, the faster resistance will emerge. So the second part I wanted to emphasize was really this difference in production impacts across herds. And again, I'm putting data up just really as much rather to go through it to really hopefully just show that we do have data on this. But this was a study we did with colleagues again at WCVM. Dr. Mary Jelinski led the WCVM side. And really, we were looking at stocker cattle and treated and untreated animals in groups of stocker cattle over the grazing season. And we looked at, this was in 2019, and over 17 herds, just basically 5 of them had a significant improvement in average daily gain. You can see the numbers here based on that particular year in terms of being treated with dewormers. So that shows in that particular year, which if you remember 2019 in Western Canada was extremely dry. So this would be a bad year for parasites in terms of not good for the parasites. You wouldn't expect a lot of parasites. And about, a quarter to a third of the herds benefited from treatment. But actually, the rest didn't. So that just illustrates the fact that in some years, in some herds, then there's some benefit to treatment, others not. So the third variable I just wanted to emphasize again is grazing management varies between herds. There's this fact that many of you may have heard before that the vast majority of these infective stages are at the bottom part of the pasture of the grass. And so if you overgraze, you get higher parasite burdens, and if you don't, you get lower parasite burdens. So in a way, good grazing management for the grass or the pasture is good parasite control as well, typically, although that's a bit of an oversimplification. And obviously, the higher the stocking density, etc., the higher the transmission and the higher problems. And one thing, again, I'd emphasize about grazing management, it does depend on exactly what's going on. So again, the devil's in the detail. And I just wanted to illustrate one example of that. And so when we're talking about rotational grazing, I've given an example of it's not, sometimes you get asked, well, I'm doing rotational grazing, what does that do for my parasite control? And the answer to that is it depends on the detail. So in these two examples, I've given an example of calves which are being moved or cattle which are being moved every month from pasture to pasture. And then we'd return to the first pasture after about 2 months. That actually increases the risk of parasites because if studies that we've done have shown that you start to get larvae leaving these fecal pats about 3 weeks after they've been deposited, and then the peak larva is about 9 weeks. So if you do a grazing rotation like this, you're putting the calves back on the pasture when there's a maximum number of parasites present. If you contrast that to doing rotational grazing where you continue to move cattle and don't put them back to the following year, then that's going to be a very low risk situation for parasites. So again, you can build in an understanding of the grazing patterns in terms of risk assessment, in terms of the need to treat, the likely benefits of treatments. So really the take home of this is we really should be doing much more risk assessment and evidence-based, but there are challenges to that in terms of control. Obviously, it's complex, as I've described. We don't have precision diagnostic tools. We have fecal egg counts, which I'll mention very briefly in a second. We have, as everybody on this call probably knows better than me, limited flexibility to production systems because there's many other factors in terms. So you're not going to change your production system in a radical way to control parasites. So these are the limitations. So I wanted to just break it down to 3 areas in terms of what can be done. We've got grazing management, which I've talked about already, but just to re-emphasize that, not both in terms of risk assessment and also managing grazing to minimize parasite impacts, if that's possible in a practical sense. And then also monitoring is important. That's one of the things we're trying to encourage people to do, is to monitor and use that built into risk assessment and only treat where it's likely to be valuable. And then more targeted deworming use around drug stewardship. So when we look at monitoring, fecal egg counts are the only diagnostic tool we've got available. They are insensitive and imperfect measure of worm burdens, and I'll just explain that a little bit more in a second. So they're not perfect, but they're still a very valuable tool. One thing I want to emphasize is there's no single threshold which says this is when you treat at this egg count. It's really going to be taken in a holistic context of the other information available. And then in terms of how you sample, what time of year, which group of animals, it really depends on what you're trying to do and the production system details. And that's where working with a veterinarian in terms of having a herd health plan around this is important. I think Colin's going to talk about more about this, so I'm not going to spend a lot of time on it. But there's a few practical things in terms of being fine about taking environmental samples, sampling at least 20 animals in a group, and then really pooling. It's okay to pool samples and send, it's okay to send individual samples to the lab in order to be pooled. But again, Colin, I think, is going to talk more about that. In terms of drug stewardship and targeting dewormer use in terms of good practice, again, I keep emphasizing only use the dewormers if they're justified by a risk assessment. Always important to use a full dose if you do treat, because underdosing in terms of too low a dose selects for resistance. And then always, it's good practice to check if the anthelmintic treatment's actually worked. And so that's, again, sampling 2 weeks after treatment. Quarantine dosing in terms of buying animals in, using a combination of the 2 drug classes to treat animals coming in, again, decoupling external and internal parasite control. And then I just wanted to finish off this section with Refugia strategies, which is the other thing we do to try and minimize treatment or use of drugs. And that's, again, leaving some animals untreated. And many of you will have heard of this. And so the concept really is, if we treat all animals in a group, which is traditional practice, what we're doing is we're applying drug selection to all parasites in the ecosystem, if you like, which selects quickly for resistance. If we leave some animals untreated, and as I'll say in a second, it's about 10, maybe 20% of animals untreated, that does a lot to slow down resistance. And so you get the benefits at a group level of the production benefits, protecting against negative health impacts, but it really increases sustainability. And so how do you choose animals to leave untreated? Well, based on condition or growth, in terms of just leaving the best animals or the animals in the best condition untreated, or it can even be random. And there's lots of strategies around that. One thing I wanted to just finish off with, before I just mention briefly about ectoparasites, is really, we do have limited diagnostic tools, and fecal egg counts are great, but one thing we really don't pick up on is the complexity of these parasite communities. There's lots of different species with different impacts, different sensitivities to the drug these days, and different levels of egg production. So an egg count means one thing if it's one species and is interpreted quite differently if it's another. So what we're doing on the research side is trying to develop better diagnostic tests to replace fecal egg counts, essentially. And we're working with the company BioVet to try and produce these real-time PCR panels, which is a multiplex panel for lots of different parasites, which would quantify these things more accurately and specifically. The other thing is the diagnostic services at the University of Calgary, for those of you in Western Calgary and Alberta, has just opened up to undertake a fecal egg count service. So I'm just flag that here. So I'm just going to spend a few minutes before I hand over to Colin on the external parasites. And I'm going to limit it to lice because it's quite a topical thing at the moment, or has been the last few years. So very quickly, the different lice species, there's 4 major lice species in cattle, and they fall into 2 classes. There's 1 species of biting louse and 3 main species of sucking lice. These are blood-feeding animal parasites, which have piercing mouse pots and feed on blood. And these are basically feed on the skin surface. You know, the data we have, such that it is, which is very limited, suggests sucking lice are much more common. But actually, it's harder to see biting lice. So the way we, as I'll say in a second, we've got very limited diagnostic tools, so we don't have much data on this at all. There are other ectoparasites such as mites, such as coreoptes, which are also problematic, but we don't really have much data on prevalence and things like that. So I want to make a couple of comments about itchy cattle and hairless. This has been a big topic the last number of years. I'm sure you're all aware of it. It can be very severe. And really, between 2015 and 2021, was really increased quite significantly, apparently, in the problems we were hearing about. Apparently, the last few years, that's kind of calmed down quite a bit, and we don't really know why. It got a lot worse, and now it's anecdotally not as bad as it was. And is that because of there's been milder winters? We don't know. We still don't know the causes of itchy cattle. It's likely to be multifactorial. There are studies suggesting there's nutritional components such as copper deficiency, but clearly ectoparasites play a role. To what extent other hypersensitivities or hypersensitive to the parasites themselves, we just don't know. What we do know is there's no accurate correlation between louse burdens and these symptoms typically. We also have increasing anecdotal reports of lice treatments not working, but again, we just don't know how much resistance is out there. We've got a lot of data on the roundworms, which I alluded to, but we have very little on the lice. I just had this nice little video from a colleague, Dr. David Voxler, in the US, and really just showing itchy cattle. And what I like about this video is you could really see both the welfare issue, but also, you know, the impact it would have on feeding and ultimately production in terms of animals which are affected. So the life cycle, there's a number of different stages. The key thing is from egg to adult and back round again takes about 45 weeks, and eggs take about 14 days to hatch. And when we look at the seasonality, and again, a lot of people know this, we see peak lice numbers typically in January, February, and a lot less in the summer, obviously. And when we look at treatment application, that typically occurs November, December. October, I think probably typically, certainly in Western Canada, is too early, and that often ends up needing a second treatment. And a lot of the treatment failures, if you like, over the last number of years, it's difficult to know how many of those are maybe just the timing of treatment relative to the weather and those kind of things. We'd be much better off if we could monitor and decide whether we needed to treat or not, again, rather than just assuming we may or may not do and not really be able to make that judgment call. I just wanted to, again, I think Colin's going to cover this a little bit, but I just wanted to just talk a little bit, extremely high level, about the different products available. There are a number. This middle group here, BOS 7 Silence, are pyrethroids or synthetic pyrethroids, which are topical. We think there's resistance to those, but we don't have a lot of data. And the key thing about these is they only kill the adult stages. and so they don't get the eggs. And so a second treatment after about 3 weeks is good practice in terms of getting highly effective treatment. This relatively new product, Cleanup True, which combines permethrin with diflubenzuron, which is an insect growth regulator, which basically kills the eggs or stops them hatching. A single treatment of this is more effective than these other products because it gets every step in the life cycle. And I think that's helped for many producers who use that. And then we have the endecticides again, we talked about with roundworm control, which in theory gets both, but as I explained earlier, we don't always want to be doing that unless there's a good reason to do it. And again, we think there's potentially resistance there, but not any data. Final slide is really just, again, a research note that, I think you probably get the impression of this, we don't know a lot about the situation in lice. And actually, you might think with ectoparasites it's simple because they're on the surface. We should be able to just simply look. But actually monitoring lice burdens is not practically that easy in terms of being objective about it. And so one of our projects is to try and develop these tools where we can deal with simple skin swabs and detect the DNA of the ectoparasites on the surface and produce quantitation or semi-quantitation and monitor burdens and assess treatment efficacy and things like that. And that's something we're trying to develop with a project funded by ORDA. So with that, I kind of rattled through. I'm sorry it was quite quick, but I tried to cover some, core principles and give some coverage, hopefully, that Colin can now kind of lever on in terms of how do you do this on a daily basis in practice.
Perfect. Thank you, John. That presentation was great. I know I learned a lot. There's been a number of questions coming in already. And just as a reminder to all of our participants, please include your questions in the Q&A and we will answer them live at the end of the webinar. John, if you're able to mute yourself and turn your video off while Carling's presented, we'll move into Carling's presentation. So Dr. Carling Matejka grew up immersed in agriculture on her family's century-old red and black Angus seedstock farm near Ponoka, Alberta. Her early hands-on experience with cattle ignited a lifelong passion for veterinary medicine and the Canadian beef industry. After 6 years in mixed animal practice, Carling joined Veterinary Agri-Health Services to focus on advancing the health and sustainability of beef cattle operations. A strong advocate for agriculture, Carling actively supports the next generation of industry leaders through mentoring veterinary students and volunteering with 4-H and junior livestock programs. Her contributions earned her recognition as a member of the inaugural Canadian Agriculture Youth Council in 2020 and selection as a Canadian Cattle Youth Leader in 2022. Beyond veterinary work, Carling enjoys powerlifting, CrossFit, skiing, and golf. She lives near Olds, Alberta with her fiancé, where they are deeply involved with their family's beef, dairy, and grain farm. With that, I will turn it over to you, Carling.
Okay, make sure I unmute myself. That's helpful. Can you see my presentation?
I can. Looks perfect.
Excellent. Okay. Well, I'm really excited to be here. Like, what a dream come true to be able to be part of the BCRC webinar series. So I'm going to talk a little bit about practical parasite management in beef cattle, or truly evicting the unwanted tenants. So moving through our agenda today, we're going to talk on the production impacts, internal parasite management, external parasite management, and pro tips for parasite management. So to start off, we're going to talk about problems with parasites. So we know that parasite burdens have a large impact on production, and they truly are silent profit thieves. So having a large parasite load can impair immune function because the immune system is focused on treating the parasites. So this makes cattle more susceptible to other infections. It's also going to have an impact on reproduction. Infected cattle typically have lower conception rates and reduced feed efficiency. So because the parasites are also intaking some of these nutrients, cattle are going to require more feed to achieve the same weight gain compared to cattle without significant parasite loads. So this goes hand in hand with diminished live weight and carcass yields, lower carcass grades, as well as a greater greenhouse gas emission effect, which we have to always remember that sustainability is important too. In terms of economic losses, parasite burdens have a large cost impact on the industry. So this is a comparison between USA, Brazil, and Mexico. And on the left-hand side of this graph, this is the US dollars per billion. And you can see that there's an estimated $8.5 billion annually lost in the United States, which equates to about $190 per head. Unfortunately, I couldn't find data in Canada, which it's not that Canada isn't losing dollars also, it's just that this information isn't available. So what we see is that there's larger impacts from those gastrointestinal parasites like roundworms. Then we see ticks, which aren't as much of a problem in a lot of areas in Canada, but still can cause issues. And then definitely liver flukes are up there. So moving into more specifics on internal parasites, like Dr. Gilleard had talked about, we see things like roundworms, lungworms, flukes, tapeworms, cattle grubs, which aren't really as common here in Canada, but are definitely a concern in the US, Coccidia, Giardia, and Cryptosporidium. And the reason I have these ones smaller is because these are more of a calf hood issue, but still fit into our internal parasites. So in terms of looking for signs of internal parasites, as much as we would like to believe that we'd be able to see these worms in feces, that's definitely not the case. So what we want to look for is we're probably going to see signs of reduced appetite, depressed weight gains, poor feed efficiency, lower reproductive rates, plus or minus diarrhea, and plus or minus something like bottle jaw that will kind of look like this. But the biggest thing to take away from this is a lot of these signs are going to be subclinical. So it's really hard to notice that maybe you've seen some changes in your overall herd weights or appetite. So these signs are not going to be easy to necessarily see. So what do we do for treatment? Now there's lots of different treatments out there, as Dr. Gilleard had alluded to. And depending on your production and management practices, your veterinarian will be able to align a treatment program that works great for you. Now, how do we economically and sustainably manage parasites in a herd? Our goal is always to minimize the use of dewormers while maximizing production and health benefits. So step one, the time of year. So typically, this is when cattle are out on grass pasture, and we want to look for those parasites about 4 weeks after pasture turnout. And the reason for that is because the parasite life cycle is about 21 days, so it takes time for those critters to creep up into the intestinal tract and start shedding eggs that we'll be able to identify in their feces. Now we can categorize our pastures into both high risk and low risk pastures, and this may change the way that you manage these groups based on the pasture risk. Another thing to remember is that larvae can overwinter in the pasture and affect again in the spring and summer. So cold does not kill these guys. That's a common misconception in Canada, that it gets cold enough that we don't have to worry about parasites, but that's definitely not the case. So when we're talking about pasture risk, high risk pastures are going to be wetter pastures, cooler spring and summer weather conditions, overgrazed or overstocked pastures, fall grazed pastures used in the spring, and pastures grazed by young stock. So these pastures are going to have a much higher parasite burden and are definitely going to be something that we want to manage more aggressively in comparison to low risk pastures. So low risk pastures are going to be very dry pastures, stockyards, pastures that have been grazed once during the growing season, especially if you're utilizing rotational grazing practices, and areas that were tilled in the summer months and left to rest for a period of time. Now, how to assess if cattle need treatment? Fecal egg counts. So Dr. Gilleard had already kind of mentioned this, but we're going to go further into it on how to implement this into your herd's program. So fecal egg counts assess the number of parasite eggs present, which allows us to determine the level of internal parasites. And it helps us be able to guide deworming decisions. Now, before you do this, you want to make sure that you inform your veterinarian and talk to them so that they're prepared to take your samples when you have them. So when do we want to do these? Cows, it's going to be 4 weeks after pasture turnout and again in the fall. Calves, it's in the fall or kind of around weaning time. And new cattle, we're going to want to sample on arrival. We always want to be taking it from fresh fecal samples, and we can pool the sample in order to save on cost. So you can collect 20 individual animals from that herd group, and they'll pool the samples at the vet clinic for you so that everything has the exact same weight in the sample that's going to be tested. Now, I made this nice little figure to emphasize this more. So what you're going to do is you're going to go out into your pasture and you're going to watch your cows. Eventually, one of those cows is going to defecate. You're going to rush out on your quad or your horse or whatever modality you use to check your pastures. You're going to collect a portion from 20 different animals in individual sample cups. You're going to place them in your fridge, not your freezer. We don't want these samples frozen. And you're going to take them to your veterinarian. Super simple, super easy. Now, the economics of this. So if we have a 500 cow herd that's split into 100 animals per group, and we choose to do fecal egg counts, you take 20 samples of fresh feces from each group, and we pool into group samples at the lab. The average fecal egg count cost is around 50 Canadian dollars. So to do the 5 different samples, that would be around $250 total. If you're just going out and treating your herd and all animals are getting a pour-on product instead, the cost is going to be between $1.50 and $2 per animal. The total cost around $750 to $1,000. And this is if you have the ability to get these animals through the chute to do a pour-on product. If you're using a product that's fed to the cattle in the field, this cost will be double to triple the amount. So then you get your sample results. So these 20 animals that you sampled are all pooled together into one sample, and you might get a sheet back like this. So if we zoom into the sheet a little bit more, the results are going to tell you the different eggs that were present, the counts of each egg, and then it should have a little graph at the bottom telling you whether or not you need to treat. So at our clinic, we do try to simplify things for clients. So we have a low risk group or animals in that group that don't need to be treated, a moderate group, and a high group. So typically we will treat our moderate and high groups with dewormer. Then step 3, your treatment plan. So you're going to work with your veterinarian to pick a product that works best for your herd. So that might mean that you're using one of the safeguard products like a mineral block, crumbles, the pellets that are then fed out in the pasture to deworm your cows, or you're able to run them through the chute and use a pour-on product like Ivamec. Now, with your treatment plan, there's some other things to take into consideration. So a combination treatment, treating with 2 different classes of dewormers at the same time. So using a pour-on Ivamec and using something like Safeguard is going to maximize efficacy and reduce resistance. I recognize this isn't the most cost-effective plan, but it is going to improve your treatment rates and it's going to reduce resistance. And Dr. Gilleard had already talked about this, but leaving some animals untreated. So the 80-20 rule is what we go by, that 80% of the parasites are carried by 20% of the animals. So in this graph, we have the number of animals that were sampled at the bottom and the number of eggs per gram in the feces. So you can see here that 20% of the animals, so 4 of the animals, were carrying 80% of the parasites. So how do we implement this into our population? I recognize, again, it's not realistic to necessarily take individual samples and wean out those animals that aren't necessarily carrying high amounts of parasites. So I like to use a body condition score. So if you haven't heard of a body condition score before, it can be at a 9 and it can be at a 5. In a out of 9 score, 5 is ideal, and out of a 5 score, 3 is ideal. 9 and 5 are obese, and 1 in both scales means that the animal is too thin. So based on the 80-20 rule, you're going to treat 80% of the population. So you're going to treat your thin cows, you're going to treat your moderate cows, and you're going to leave your obese cows untreated. If you want to take this a next level, we probably are putting a bit of a selection pressure on these parasites and on your herd if we're keeping these thin cows that are more likely to have parasites. So if you find that these thin cows are sticking around and always seem to be the ones that are constantly high shedders or constantly never have weight on, it's probably best just to ship her off and send her to auction. That way, most of your herd, you'll be selecting for cows that maybe are more parasite resistant. Now we want to evaluate the success. So we want to make sure that we have an effective treatment and we don't end up with a partially effective treatment or treatment failure. So these little red worms are resistant parasites in the herd, which is possible, very possible to happen. So we want to make sure that this truly isn't happening. So we do fecal egg count reduction tests. These are done at 10 to 14 days after treatment. And again, we take 20 samples from fresh feces, individually packaged, and we take them to the veterinarian for analysis. Successful deworming means that there's a greater than 90% reduction in parasite eggs in the manure. Now, what happens if you have a minimal reduction? Does that mean that there's some resistance in your herd? Does it mean that you had improper application of dewormer? Did you possibly apply your dewormer at an inappropriate time? Talk to your veterinarian and make a plan, and they'll be able to adjust your program to minimize this problem. Moving into external parasites. So like Dr. Gilleard had talked about, we know that lice is a problem, coreoptic mites or mange, flies, horn, stable, and house flies, as well as ticks. And we know that flies carry other diseases like pink eye that can definitely limit the production of your herd. And ticks can carry things like tick paralysis and bloodborne diseases like anaplasmosis and babesiosis. Signs of external parasites are going to vary a little bit, but more commonly what we see, especially with lice and mange, is they have a few different signs in terms of distribution in their body. Flies and ticks are usually pretty easy to identify, whereas lice and mange are a little bit harder. Signs of external parasites, obviously seeing the visible parasites, itching, hair loss, stress and irritability, changes in grazing behavior, and production losses. Lots of different treatments available again. And some of these treatments you might have seen on the last page, like Ivomec. But what you need to pay particular attention to is what these products have on their label for treatment, because they do have different abilities to treat certain external parasites. And then this second treatment is really important as well. External parasites are not the only cause of hair loss, though. So if you feel like your treatment isn't working or not responding, then it's very possible that you might not have parasites as your main problem. So we need to investigate it further. Things like nutritional deficiencies, zinc, copper, and vitamin A deficiency are going to cause hair loss. Photosensitivity, like cattle eating St. John's wort or cattle that have underlying liver disease. Natural shedding, so there's going to be that winter to spring shed. And then also if animals have had a previous fever event, they can have their hair follicles enter a resting phase, and it can lead to temporary hair loss in certain areas. So step 1 of external parasite management, identifying the pest. So lice, we know are hard to see, but take the extra time to try to look for them. Part the hair, find those pesky little buggers, and know that they're actually there. Flies, you might see, well, flies are always going to be there. We know that, but we need to decide whether or not they're going to be a problem. So are they a problem? They're a problem if we see signs like this. So cattle crowding in big pasture spaces. This is them trying to avoid flies, as well as obviously seeing visible flies on the animals. So there is an acceptable level of flies that are allowed to be there. And then there's an undesirable level that truly does impact production. Ticks, obviously seeing the ticks, and mange is something that we need to be able to diagnose under the microscope. So both flies and ticks, you're typically going to see in pasture conditions and in the warmer months, whereas lice and mange, you're going to see in confinement situations and in the cooler months. Your treatment plan. Work with your veterinarian to make a treatment plan. And again, the biggest thing is going to be looking at that label. You need to make sure that the bug that you're trying to treat is truly on the label and that you're following it appropriately with that second treatment. So follow the label of the product, dose based on weight. Please do not just open the jug and pour it on the back of the animal. Weigh a couple cows running through the chute and adjust your dosing gun for the appropriate weight of that animal. Pour on clean, dry skin, and make sure that you pour on the correct areas. And an example of this is when you're treating for biting lice, you need to make sure you pour across the whole back. And the reason for that is suckling lice bite and suck the blood. So they are able to ingest that blood and the product that's been absorbed from the cow. Whereas biting lice have to travel around the animal and through the product to actually be killed. So please don't just pour in one spot, because then you're truly not getting the actual application from that product. Treat groups that actually have the pests present or are at high risk for parasites, and try to rotate your insecticide treatments year to year to reduce resistance. Now this talk about second treatment. So it's important to do a second treatment because most of these products won't, or all of these products will not kill the eggs. So when the eggs hatch in 14 days, then we need to make sure that when they mature into adults, we have the product available there to kill them too. And I'm sure you're all asking, why have they worked in the past without a second treatment, but they don't seem to work now? Well, it could be that you're treating for something like lice going into the warmer months. And we know that lice typically doesn't seem to be a problem as much in the warmer months. And that's because they don't like to live on warm backs of animals. So typically the hide of the animal is too hot for them to survive on. There could be some resistance that's starting to form with these products, which is another reason why we need to use them appropriately and rotate products. And Ivermectin can stay in the blood for up to 49 days, but it's possible that maybe it just doesn't have a high enough concentration at that point to kill suckling lice. Step 4 is reducing the risk. So avoid confinement situations, do proper manure and water management. That includes eliminating old feed and carcasses, and use fly control in sheds and buildings, like chemicals, tape traps, etc. And then finally, step 5, evaluate your treatment. Ensure the parasites are gone and that they're being properly managed. Finally, our pro tips for both internal and external parasites. Apply dose based on weight of the animal. Do not apply to snowy, wet, or manure-covered hair. Avoid unnecessary treatment. Only treat if the parasites are there. When possible, rotate insecticides of different drug classes. Avoid overstocking and overgrazing. New animals, quarantine, test for or visualize parasites, and then treat prior to entering the herd. Consider rotational grazing strategies. And finally, cut ill thrift potential high parasite shedders from your herd. Thank you very much for listening.
Thank you, Carling, for that presentation. Again, I learned a lot from your presentation as well. Thank you to both you and John for your presentations, and you've provided a lot of valuable information for Canadian beef producers. So we're now going to move into the live Q&A session, and we've had quite a number of questions come in, so I'm just going to work kind of from the first question and work our way down. So the first question that we have was, accumulation of larvae on pastures would be highest in the fall generally, I think this is referring to a chart that you had shown in your presentation, John, that had potentially indicated that winter had the highest levels of larvae on pastures.
I need to check that slide. That wasn't the intention of the slide. Yeah, it may have just been because it was a stylized chart, but no, absolutely. So you get the peak levels towards the end of the grazing season, right? So getting end of September, October, and then when you start to get beyond that, then they start to decline again. So yeah, the peaks are in the fall, essentially. Yeah. So I need to check. I'll adjust the slide if it is slightly off on the stylized diagram. Yeah.
Sounds good. Perfect. The next question is, do parasites or larvae die in direct sunlight?
Yes, they do. They don't like sunlight, but it's not some. Well, okay. I have to be careful on that. The main thing is basically dehydration. So it's when when they dry out. So they need moisture at some level to survive. So they don't like UV light for sure, but it's really and I noticed some questions coming in about harrowing, which is what's behind this, I guess. Um, so so yeah, the short answer is they don't like UV light, but the main thing which would kill them is exposure to low moisture. Yeah.
Okay, so that kind of goes into the next question then on in regards to intensive grazing. If you harrow the field after grazing, does that help to reduce parasites in the pasture?
The answer is yes. I mean, by exposing the parasites to, I mean, it, it's a little bit complex, right? Because if you harrow and disrupt the fecal pack, you're releasing the larvae onto the pasture. So for a short period of time, you're going to have larvae there, but then they'll die off much more quickly than pre-harrowing. So yeah. So yeah. I don't know if you want to add to that, Colin, if you've got any comments. I'm answering all the questions, so I'll let Colin jump in.
Nope, that was good.
Next question is, can ground feeding, such as rolling out hay or bale grazing in winter conditions, increase parasite transmission, or is this more of a summer grazing problem on pasture?
Yeah, and again, in my rushing through trying to pack information into the presentation, I probably didn't spend enough time on the life cycle, but essentially, any eggs which pass out onto the pasture in the winter die. That's the first point. So, but the larvae can survive to some degree on the pasture. But essentially, they're pretty inactive, and then the levels become very low. So there's essentially no transmission in the winter. So it's any feeding off the ground in the winter, that's not going to be a risk factor for picking up parasites. It's kind of a dead period of the year. It's when the temperatures warm up, that larvae become active again, they become higher onto the pasture, and then you start to pick them up. So
yeah. Next question, and I'm not sure if you want to answer this one, Carling. But when you're treating animals, have you ever noticed that one animal in a group of treated animals will return to have a heavy load of lice versus other animals in the group?
Yeah, definitely. I would say that there's still so many individual aspects to every animal too, and maybe that's an animal that's a little bit thinner, harder done by, so it's going to be more susceptible to needing repeat treatments. Which, if that's an animal that keeps coming back through the chute and you're having issues with it, she's got to go down the road, because she's going to be one of those ones that's going to be a bit of a money pit and probably a selection pressure for parasites to be in her lines.
Can I just add something to that? I mean, that's absolutely right. I mean, I think it gets to the point, and Colin actually mentioned it in her talk with internal parasites, but it applies to external as well. You get a minority of animals with higher levels and a larger group with lower levels. So you can have a situation, as Colin describes, of one animal for underlying other reasons, which is, heavily parasitized either internally and or externally, and it's problematic. But also when you look at a group of animals and you run through the chute, it's trying to get an overview of the herd level infection is actually quite difficult, right? You see the odd animal with a heavy burden. Is that because of what Colin said, or is it because it's just those higher ones coming through because you don't really see much on the others? So it's going back to that point. It's actually, it's surprising, and Colin can correct me because she's at the sharp end of this, but it's surprisingly difficult to really have an objective assessment sometimes of, what is the lice situation in the herd, and just from those reasons.
I agree.
Perfect, thank you. There's a couple of questions on cleanup, a product that you had mentioned, John, and whether it is still available for use in Canada.
Yeah, go on, Colin, you speak to that.
No, sadly, it's no longer available for use. Wah wah. It's sad. We're really sad about it. We loved that product, and most of it came down to regulations. I was chatting to the company that produced it, and weirdly enough, it actually had to do with the lobsters in Canada, because it will stop, that same drug stops the lobsters from being able to molt their shells. So they just kind of lumped the product all into the same category and have not allowed it to cross the border anymore.
Yeah, and it does speak to a couple of things, this, right? I mean, one is the environmental impacts of these products is it's an example of it, right? In terms of there are, and that's an extreme example and the rest of it. But I think the other side of this is, and again, I don't know, Colin, what you think, but there's this reason that we've had fewer issues for a number of years. I don't know how much cleanup use there was. You'll have a better feel than me of it. And now that's gone away, we'll start to get more problems again. It's not the only thing, clearly. I mean, there's other things going on, but it was a useful product for a lot of people.
Yeah, definitely. And is correlation causation? Like, I would say there definitely was really good uptake from producers using cleanup. Was it the reason that we saw less external parasites? Who knows? But regardless, unfortunately, not available in Canada anymore.
The next question is there screwworm in BC? Anyone?
Not that I've heard of.
I do.
I feel like
go on.
No, I feel like the CFIA would have notified us if it was here. I have heard nothing about it.
I don't know if there's anything behind the question, but I'm not aware of anything. But
Okay.
Somebody might know something we don't. But
next question is regarding fecal testing, and what percentage of clinics will do samples, and what fecal test should we get them to use? I've heard some tests are not as accurate.
Yeah, if you're working with any sort of large animal clinic, they should do fecal floats or have the ability to send the fecal samples to a lab to have those tested. So even if they don't want to do it themselves, they still have the ability to send it out. So I would say most clinics have the ability to. In terms of the exact test, Dr. Gilleard can probably comment on that more in terms of which one is best.
yeah, and again, I just realized, again, rushing through slides, I should have mentioned, I mentioned the diagnostic services unit at Calgary's vet school, diagnostic services, that goes through veterinarians. I should emphasize that. That's not for producers to send them directly to the lab. So it's a bit like Colin said, they would do that service. I think cattle are challenging because the egg counts tend to be relatively low, partly because of the volume of the feces. So you saw the figures that Colin showed, 10, 20, 30, 40 eggs per gram. So you need quite a sensitive test. And so there's something called the McMaster, which you can do that, but most versions of it are really not sensitive enough. And so the more sensitive tests require centrifugation in a lab with a proper fecal flotation. And so really, I don't know whether, I mean, basically the bottom line is modify Wisconsin's a good test. Mini flow tax another. These are just technical terms for certain tests, but essentially for cattle, like horses and sheep, for example, have much higher egg count. You can get away with quicker and easier tests, but the cattle do need to be done properly in either a good practice diagnostic lab set up to do it or a diagnostic lab. So yeah, and I notice I'm anticipating the questions, but I can do a dual answer. Somebody said I've got a microscope. Can I
Yep.
do it? So it's related to this. Actually, sheep producers can, because the egg counts are higher, you can use these non-centrifugation tests. So we do have a number of sheep producers who do their own fecal egg testing, and if they're really into it, that's great. But the cattle producers, it's difficult because you can't just do it with a simple desktop test without the lab setup. So yeah,
Oh, okay.
for cattle, you do need to send them into the lab. Yeah.
Mhm. Another question on the fecal testing. And the question is, are you only doing this test 4 weeks after releasing the animal to pasture to prepare for the November, December treatment?
No, so you would want to do it that 4 weeks out in pasture, and then depending, it's going to depend on multiple things. So then depending on whether or not you do your fecal egg count reduction test, so that other test 10 to 14 days later, that's going to give you a good gauge on where your baseline is at if your treatment worked. But then you're going to want to repeat a fecal egg count test again in the fall to assess again whether or not treatment needs to be done. So that fall treatment is something that absolute fall treatment that every cow gets is something that we want to try to move away from and use more data-driven decisions to decide whether or not to treat herd groups. Dr. Gilleard, can you comment any more on that?
No, not really. I mean, I think again, I know it sounds a bit of a cop out, but it's going back to this, speak to your vet and look at exactly what you're trying to do and the production system you've got and when to sample. Because it's hard to give this generic advice. Sampling, as Colin said, 4 weeks after turnout's one good time. If you wanted to assess worm burdens of calves going into a feedlot, for example, then you could test the calves later in the year and see what the situation was. But obviously that's either appropriate or not, depending on where the calves are going and all that situation. So I think it just depends on the thing. But yeah, so typically 4 weeks after turnout, if you want a rule of thumb, that's kind of the rule of thumb. But really you need to speak to, have a herd health plan on it and talk about the specifics and the specific situation.
Mm-hmm. Next question is there a genetic link to a cow's ability to rid herself of parasites?
Who wants to answer that? I'll do.
Yeah.
Go on, you go ahead.
Oh, I can't think off the top of my head if there's actual genetic testing, but there's definitely, it's speculated that there are cattle that are more resistant to parasites in comparison to others. So is that necessarily something that's genetic linked, or is that something that, those cows have consumed more, have a better body condition score, or able to, their immune system's able to get rid of the parasites? There's probably multiple different things that go into it, but I would say probably a genetic link to that.
Yeah, I mean, the heritability of egg counts is quite high, so there's clearly some genetic link, but it's a combination of genetic factors and environmental factors in terms of what determines. But certainly, in anything actually, whether it's horses, sheep, or cattle, it tends to be the same individuals who are, the horse owners call it wormy, right? A wormy horse, right? It's always the same one in the group or the same few in the group. And it is true, and there's more work done on the sheep side than the cattle globally. But you can breed quite well for parasite resistance by selecting the right animals which have low egg counts or some other measure of parasite burdens. So it is certainly a strong genetic component. How you do that in practice, as I say, in the sheep sector, there's quite sophisticated ways of doing that breeding. The cattle, it's less common, but certainly, in theory, if you cull more wormy animals, you would get some benefit in the herd, but the practical application of that, and as Colin says, there aren't really genetic markers which you can use as selective breeding or anything like that.
Oh, thank you. Next question is, how prevalent is tick paralysis on the prairies in Canada?
Ooh, That is a good question. I myself, I have not seen a case of tick paralysis, but I know that it happens. Like cattle that are out in the bush, mountain area, there's ticks out there. It pops up, and truly, it does. You remove the tick, and then the animal's fine.
Yeah. It's like a magical, there's a mystery to it actually. I've got a colleague in Calgary who's actually working on this. He's a mill parasitologist, but basically the situation is in BC, it's a regional thing, right? There's a much bigger problem in British Columbia than there is in Alberta and Saskatchewan. So there's a regionality to it we don't understand, and there's still some genetic difference in the ticks which make this difference. So in Alberta and Saskatchewan, it's not as common. It's not as big a thing, but yeah.
Next question is injectable ivermectin more effective for internal parasites?
Do you want to?
No. Well,
Okay.
I'll answer it, but then correct me if I'm wrong.
I'll go.
I don't think that there's any difference between injectable and pour-on, as long as the pour-on's properly applied so that there's a systemic absorption of the product, then those worms should be killed at the same amount.
Yeah, I think there is a difference, but
Okay.
it's how practical, because I think, one of the things with pour-ons, which is interesting, is the absorption isn't quite what people thought early on. So some of it depends on self-grooming and co-grooming. So some of it's absorbed through the skin and some of it is orally ingested. And so, people have done trials where if you tether animals so they can't groom each other themselves, you get a lot less absorption. Having said that, when the products were first launched, pour-ons were highly effective, right? I mean, if you look back at the data, used a pour-on, you kill all the internal parasites. As the data I showed, that's no longer the case. But that's also true of injectables as well. It's a resistance problem to the drug. But I do think injectables, and that's why when we do a fecal egg count reduction test, that trial I showed, to do the actual, is there resistance there? By dosing at the full dose of an injectable, you're really hitting them hard. But so
it's not like in a perfect world, if every animal was dosed with the proper amount and absorbed properly, then they would be the same. But
exactly. But what I would say is if the pour-on isn't working, there is a chance the injectable will work better, but it probably means you've got resistance, and probably it's the other product like Safeguard or something would be the one to go for. So there is a difference, but not massive, right?
So the next question is regards to flies and using cattle oilers. So when using cattle oilers, should producers just be treating when fly numbers are high?
probably depends a little bit of the product you're putting in the oiler. And we don't have as many clients now that use cattle oilers. So, John, I just don't have as much experience with them.
Yeah, and I would actually, in all honesty, I'm not an expert on this in terms of that. So, right, yeah, I mean, I think I'm not probably the best person to answer specifically about oilers.
Yeah, it's gonna truly depend on the product that you're putting in there and what the label recommends for when it needs to start, because it's gonna depend whether or not it's a fly deterrent versus like an insect growth regulator, or what its actual mode of action is.
Okay. Next question is, can the products used to treat parasites also harm the insects that help to decompose fecal pats?
Go ahead,
So
Dr. Gilleard. You touched on this a little
repeat
bit
that
more.
again. I was looking at another question when you spoke. Sorry, I just noticed another question. So can you just repeat the question? Sorry.
So can the products used to treat parasites also harm the insects that help decompose the fecal pats?
Yes. And that's one of the things I was alluding to with environmental impacts, right? So, I mean, dung beetles are the classic, and there's a lot, you hear about it less here, but UK, for example, you might argue over obsessed with it, but there's a lot of talk about impacts on the communities, which, so dung beetles is one. Others are other insects and things like nematodes, actually roundworms, which are free living ones, which are actually good for decomposers as well. So you do see there is data which shows that fecal pats take longer to decompose when they are when treated animals. So that data is there. So yeah, and that can obviously have all sorts of impacts. But yeah, so the short answer is yes.
Perfect, thank you. Next question is, how long can larvae survive on pasture after cows have been moved off of it?
Yeah, and that was again because I didn't have enough time to stick on the slide. But if you remember the rotational grazing slide, there's some data on that. So if you look back at this and look at the left of that slide, you'll see the data. But essentially, what the study we did here in Alberta on several herds is we looked at this rotational grazing. So fecal cats had been deposited, and then we looked at the larvae coming out on the pasture and how long they lasted. And so what we saw, this started to appear about 3 weeks after the fecal pat was deposited. They peaked about 9 weeks afterwards, and then they started to decline after that. And they won't go away. I mean, they can survive up to a year, right? And some of them do survive over the winter here. It's a bit of a misnomer that the winters kill them all. They don't. Some do survive, and actually surviving inside the fecal pat is a kind of a good environment for them to survive, actually. So undisrupted fecal pats under snowpacks and things like that. So the bottom line is 9 weeks after the fecal pat's deposited is the peak in this part of the world, roughly. And then after that, it gradually declines.
Okay. Next question. If the cow herd was fed exclusively in troughs, would that interrupt the parasitic infective life cycle?
Yeah, I mean, if there's no grazing, there's no parasites. I mean, literally, right? I mean,
Yeah.
all the transmission is from the grass. So, yeah, I mean, so if and housed animals are good, like for example, dairy cattle in Alberta, we don't worry as much about roundworm parasites because the house there's no transmission, right? So I think, yeah, there's no transmission if they're not eating grass, essentially.
Okay, perfect. Thank you. Next question is, what is the best product and when is the optimum time to treat horses and cattle for tick control?
Go on, Colin, you can do that.
Well, definitely not a horse vet by any means, so I have no idea about horse products. For tick control in cattle, there are a few different products. Like Boss and Backline both have some tick control, and Sabre, I think, also has some ability to have tick control too. But you need to follow the label to make sure that you're repeating the treatments at the appropriate time because it's not going to be a one and done type of situation for the summer.
Sounds good. Next question is, their liver flukes were not mentioned much within either of your talks, and why not talk about flukes that are responsible for a small amount of feedlot mortalities each winter due to leaking livers causing peritonitis?
Oh, that is, I did mention flukes, that they are a problem. Why didn't I expand on them more? I don't think that I have a good reason for that because we definitely do see them. We don't in cattle that are primarily only from our region in Alberta, we don't see it as often, but definitely cattle coming from Manitoba, we definitely see some liver flukes. Um, I don't know if I can comment more on it other than just making sure that you are treating appropriately.
Yeah,
John, go ahead.
no, I mean, the reason I didn't comment on it was the same reason you, Colin. It's just time, right? It's just like you probably put too much in the talk anyway. But yeah, so I mean, it is a good point. I mean, but there is something which is a couple of things worth flagging. First of all, when you talk about liver fluke in ruminants, if you talk to most people in the world, they're talking about this one called fasciole hepatica, which is the big liver pull. It's in the US, it's in Europe, it's a big problem. And it's transmitted through cattle, and there's a snail intermediate host. So it's, it's pasture grazing of cattle transmitted to cattle. The one we have here, as far as we're aware, in terms of, and certainly by the vast majority we have here, is a different one called the giant liver fluke, which is actually in cervids. So it's in elk, deer, and it's transmitted that way. And cattle are a dead end host. So cattle don't transmit it through their grazing. It's where they're grazing pastures which have been contaminated by wildlife, essentially, or wild cervids. So the control is much more about that, is separating the access to grazing from deer and the rest of it. And if there's a problem in a herd, which is becoming apparent at the slaughterhouse, then that's where they're getting it from. And it's very difficult to control with the drug because you're not controlling the transmission of the cattle. So it is a problem, but it's problematic. The one thing about Manitoba, it's interesting you say that, Colin, because yeah, it appears that it's becoming more of a problem there, and we've got a study at the moment trying to look at that. So yeah. So we didn't talk about it much, but it's a whole nother topic, I guess.
Okay, thank you, both of you.
Stay tuned for another webinar on liver flukes.
Yeah, exactly.
So we're going to answer just a couple more questions just because we are getting late on time here. We've had 2 questions come in regarding insecticide ear tags and whether they are a reliable option.
I mean, I don't know as much about the data on it and whether or not they are, but I think in terms of anecdotal and what I've heard from people is that they do work when they're put in at the appropriate time. So you want to make sure that they're actually put in when fly season starts, because they're going to act more as a fly repellent versus anything else. Dr. Gilleard, do you have any data information on insecticide flat tags?
Not specifically above what you've said.
Okay. Final question. What are your thoughts on using garlic and mineral to help control flies?
I knew this question was going to come up. So garlic, the reason that it is supposed to deter flies is it makes the cattle produce a certain smell that the flies don't like. There's not a lot of data on it. Again, it's just coming from more personal experiences that people say that it helps or it doesn't help. Depending on the lick tub that you're getting, if it's something with garlic in it, it might also have another drug in it that, or anti-parasite in it that is an insect growth regulator, and that's probably doing more of the work to mitigate the fly population than what the garlic is doing.
Okay, perfect. Thank you. Did you have any other comments on that, John, before we wrap up here?
No, that's good. I'm seeing lots of interesting questions, but we've run out of time.
Yeah, since we're not getting to answering all of the questions, unless you guys want to stick around for a few more minutes and we can answer a few more, that's up to you.
Doesn't matter to me.
I'm good. I've got one. I just saw a question that I just interested what it's about. Is mange more a common problem in cattle where there is a problem with the coyote population? I mean, I don't think so. I mean, I'd be interested to hear where that's coming from. I mean, when we think of mange, we think of Coreoptes, which is the main problem, which is a cattle louse. I mean, Sarcoptes you see in coyotes, and in theory can infect cattle, but I'm not aware of it being a problem. But it might be my ignorance. But yeah. So I'm just curious with the question as to why somebody's specifically asking that.
Okay. And there's another question above it there too on, is there any point to give an ivermectin or saber-poron to calves at branding?
Sorry, I missed that.
So for saber, it would be more for your like tick control, might have a little bit of fly control, but in terms of giving something for internal parasites at branding time prior to turnout, those calves definitely have not been grazing and are not exposed to parasites. So an external parasite treatment is not necessary.
All right, perfect. Thank you, Carling. I think we'll close it out there. just in essence of time. Thank you again, John and Carling, for your presentations and sticking around to answer the questions. We had a lot come in and we did not get to all of them. If the questions didn't get answered, I would encourage participants to reach out to their veterinarian, or they can reach out to us as well, and we can follow up with our speakers with other further questions that didn't get answered. Thank you again to our speakers, and thank you all for spending your evening with us. We hope that you gain some valuable information that you can bring back to your operation. This webinar was the final for the 2025 webinar series, and there will be a post-webinar survey link once this webinar is over, and we appreciate any and all feedback on the webinar, as well as for potential future topics as we plan for the 2026 webinar series. Again, thank you, John and Carling, and have a good rest of your evening, everyone.